That is just a sample of what post-secondary students have been up against. There is so much more to talk about, which is why we're joined by Dr. Andrea Levinson, psychiatrist in chief at the University of Toronto, and Behan Farhadi, an education expert at York University. Thank you both. And Dr. Levinson, if I may start with you, in terms of the struggles for students, what have you seen over the past year or so that has struck you or surprised you?
Well, I think I'd like to sum it up by the tremendous resilience, the strength, the creativity, the poise that students have really shown during the past year, and the whole university community, staff and faculty and administration in supporting students during this time. But, you know, the notion that the WHO put out in "we're all in this together" does not totally pertain to all students. There are inequities, and some students have definitely struggled more than others. Students who've had prior mental health difficulties, for instance, those have been worsened during the pandemic. There's been lots of expression of anxiety and loneliness and struggling to connect, which is a very real consideration.
And Behan, you know, when I listen to that, I think about online learning, adding to these challenges. What are the particular effects of that?
I think that as much as we think that we can replace the in-person experience, there are limitations to what online learning can provide. It's very hard to replicate active learning, and especially for live synchronous sessions, it's not always the case that students are able to participate from home because it's a private space, and not every student feels comfortable turning on their camera and engaging as they would if they were in person.
So I have no doubt that there are people listening to this at home who have a student in their life who they're worried about. Dr. Levinson, what can they do to help?
They can firstly validate what the student's feeling and acknowledge it, comfort the student, and stay connected. When a student was displaced from the home, usually in a traditional university environment, we would always advise family to stay connected beyond text and chat. You know, keep that live connection going, and provide a lot of comfort and empathy for what the student's going through. Don't aim for perfection, you know, the kind of 4.0 GPA, really just making room for mistakes. Encouraging healthy habits in the student and sort of drawing the connection between those healthy habits and how much better one feels when one's eating well and one's sleeping well. And if there are observed changes in the student, you're really noticing a change in behavior, in sleep, they're more isolated, then enlisting the kinds of connections to professional support is really, really important.
And last thought to you, Behan, I find it especially worrying to hear students say they feel unprepared after this last little while, and that helping them is probably going to be a job not just for teachers but employers. So what should employers, for example, do differently in this era to help these students set up for success?
It used to be the case that in many professions you would have a sense of the experience or knowledge sets that students would be arriving with when they are early career. I think not making assumptions about what is known, providing as much as possible a mentorship opportunity so that folks entering a career can have the connection, but also an opportunity to bridge any sort of outstanding skills that might need to be caught up on. I think there's a lot of folks already who are even late career who are encountering a new context. And so I think sometimes it's unpredictable to know what it's going to look like when you start transitioning, depending on your field.
Okay, mentorship will certainly help. Behan Farhadi, Dr. Andrea Levinson, thank you both.
Thank you.
Thank you.